it is a huge, huge honor today to be interviewing probably the most famous dentist on earth, the legend Bob Ibsen. I'm going to tell your story first to my listeners. You're talking to about 7,000 dentists today, Bob. And
Okay.
so Bob Ibsen let me see if I got this story right. First, you were an optometrist, right?
Optometrist, yes.
Optometrist. And when you study to be an optometrist, you learn all about color and light and materials and how they reflect light and everything. And it was kind of a perfect storm. Then he goes into dentistry. He's in Southern Cal, and you were at the ground zero of the cosmetic revolution, from going from everything being amalgam and gold, and out there in Hollywood, everybody wanting white. And you wrote the first book in cosmetic dentistry, and it was actually called Adhesive Dentistry. And they didn't have any materials to do what you wanted to do for all these Southern California people that wanted white smiles. So he starts his own company, DenMat, meaning dental materials, and it was all adhesive dentistry. It was all the ground zero, the first products I ever saw that did cosmetic dentistry was you. And then later, Bob doesn't like the way. Is Bob okay to call you Bob, or do you want me to call you Dr.
Why don't you
Ibsen?
call me Bob?
Call you Bob. And so then Bob didn't like how the toothbrushes, the toothpaste, were affecting the luster on the cosmetic dentistry he's done. So then he starts his own toothpaste, the first premium toothpaste, Rembrandt. Before that, toothpaste was all a commodity. All the tubes were the same price, the same ingredients. And you started the first cosmetic toothpaste, Rembrandt. And my God, Bob, what are you going to do for an encore?
Well, I'm talking to you.
You're talking to me? What a letdown to an illustrious career.
Let me tell you why I'm talking to you. Because you've got 7,000 dentists listening to you that highly respect you and regard you. And I find that there's a lot of resistance on the part of dental laboratories to dentists doing so much cosmetic dentistry without removing so much tooth structure.
And see, that's another thing you were ground zero from. Minimally invasive dentistry. You were doing it before anybody even said minimally invasive dentistry. You knew from day one that peeling off all the enamel is never a good idea.
That's right. And I don't know what I didn't know. I do know now that when I would do my restorations, I would just do the wax up. If it looked good, we press it in porcelain. So for 30 years, I've been doing bonded porcelain veneers, never given one patient an aspirin, an injection. I use the patient's sensory system to tell me when I should stop removing tooth structure. If you don't remove sensitive tooth structure, you won't irritate the pulp. If you don't irritate the pulp, you won't have sensitivity during or after, and you won't have root canals. And you know that a lot of dentists that have been taught techniques for doing veneers have had patients that experience a lot of sensitivity. And in some cases, they have to go to an endodontist to get the nerves removed. So that prevents you from helping a lot of people who have beautiful teeth that could look better in alignment. And all you have to do is take an impression, give it to a knowledgeable technician who can do a beautiful wax up for you, and then press it in porcelain. It doesn't have to be uniform. It doesn't have to be contact lens thin. You always know when you're getting the wrong information when they're using euphemisms like contact lens thin. Sometimes it is. Sometimes it's very thick. I'll show you some examples a little later of things that I've done without ever having to give the patient one drop. Now,
but Bob, I want you to talk to these dentists about one thing. The dentist will tell you, if you say that does root canals, I'll say, what percent of your root canals fail? And they go, oh, knock on wood, I've never had one fail. Then you go to the 4,000 endodontists, and they say that 3 out of 4 root canals they do is a retreat. So are all these retreats just done on patients that immigrated from another country? And secondly, if you ask any of these cosmetic dentists, hey, if you prep upper 10 for veneers in 10 years, what percent of those teeth need a root canal? And they go, well, knock on wood, it's never happened to me because I think I do it just right. Then you go to the endodontist. How many times do you have to do a root canal on some tooth that had all the enamel prepped off for veneers? And they go, oh, every other day. I mean, so the dentists only know what they know. They don't know what they don't know. Bob, so tell them, if you prepped conventionally the upper 10 teeth for upper 10 veneers, 10 to 20 years later, what percent of those teeth do you think died and needed a root canal?
Well, I used to study with Charlie Stewart, and Charlie was a guru of gnathology and occlusion. And he used to say that porcelain fused to metal crowns were tombstones. They mark the site of where a tooth has died or about to die. So it's trauma. If you don't traumatize the tooth, you'll never have to do a root canal on it unless it's for some other trauma. But most of the endodontic restorations are done on teeth that have restorations, and some of those needed restoration. So here's how I am able to do all my cases without anesthetic. I'm selective in what I treat. So, in other words, you've got patients right now in your practice who have teeth that are a little crooked and they would like to have them look better if they didn't have to have their teeth ground down. So there's a huge opportunity that the profession is missing because we've been told by dental laboratories how much tooth structure to remove. That means a shot, that means sensitive tooth structure, and then if you want to do things with the gingiva, you want to get your gingival architecture established and have that accomplished before you take the impression for my veneers. So I go to the technicians once we've got the foundation set, no caries, they're eligible for 6-month check recall appointments, and they like their teeth to look better. So then these people become a candidate. We show them what can be accomplished without shots or drilling. I take an impression. We have a wax up with the technician who knows what he's doing and good at cosmetics, because not all technicians are that good. And they teach us to cut the tooth structure down because that's what we did when you and I got out of school, because that's how we got retention. We had to do, remember part of your preparation was for retention?
Bob, I want to ask you something.
Yeah.
Kind of. I want to say this politically correct. I mean, obviously, anybody can say I was born in Kansas. You can tell me I was born in a barn in Kansas. But when I look at the cosmetic things, I want to first throw me under a bus. Look, I'm a short, fat, bald guy. You know, I'm the first to admit it. But when these dentists are talking about, well, they have to remove tooth structure to keep the tooth uniform thickness to make it look all natural. Bob, when I look at these fancy women, there's nothing natural looking about them. They got bleached blonde hair. They got red lipstick on that doesn't look natural. I mean, when you see a woman with red lipstick, do you say, wow, your vermilion border has very dilated arteries and veins. There's so much blood flow in those lips. They just look amazingly red. When they get boob jobs, the number one complaint of a boob job is that they're too small. They got these boobs that defy gravity and they're pointing up towards the stars. I don't look at, they got long fingernails painted. They got high heel shoes on. I mean, when I look at a made up woman, there's nothing.
Do you have that magazine here?
There's nothing natural about it. I mean, why are you stripping off all their enamel to do something when I don't even see anything natural looking at this woman? Furthermore, if you thicken the teeth even just a millimeter, their lips are more full, they have less wrinkles, and they're getting Botox and derma filler for that anyway. So I mean, I just don't understand why we're stripping off enamel to make a woman more beautiful when she's already drop dead gorgeous to begin with. I mean, what is the deal there?
Well, of course, part of the problem is the patient. So there's the last question I ask in our smile evaluation is, what would you like your teeth to look like? So that's the answer you got to satisfy. What would you like your teeth to look like? Now, some people think that's beautiful, just what you're talking about, but it's unnaturally beautiful, but they like that. I had a lady one time when I was a younger dentist. I was 62, she was 68, and that's when I learned about older women. So she came in and she was a perfect case. The endodontic or the periodontist had done all his work, referred her in, her teeth were crooked, discolored. I couldn't miss. Those are the easy cases. The hard ones are when they're a 9 and they want to go to a 10. Those are tough. But anyway, so I took the impression and I did everything and it just went along beautiful and I gave her shade A2. So normally when I put these in a patient and I'm finished and I give them the mirror, they, oh, doctor, you're wonderful. How many women throw their arms around an 83-year-old man and say, you're wonderful? You know, that's why I still do this, because it's so easy to be wonderful. There's no work involved if you know what you're doing.
Are you
So
83?
anyway,
Are you 83?
I'm 83, yeah.
God dang, you look good, Bob. You
Well,
look
thank you. That's
amazing.
because I don't kill pulps.
And who was the older dentist friend that you always hung out with that was 10, 20 years older than you when I first met you 30 years ago?
Who was the dentist?
Yeah.
You mean that did the first veneers?
No, your friend. When I met you 30 years ago, you're
Oh,
83.
Harold Case.
Harold Case. Gosh,
Oh,
darn, I love Harold.
He was a wonderful guy. I miss him.
I miss
say
him
good
too.
morning to him every morning when I walk in the office. I got his picture on my desk.
How old was he when he passed on?
Oh, he was 90-something. He was a good guy.
God, he was a great guy.
Yeah, he was just a tremendous person as well as a good dentist.
Well, if anyone makes it to
But
100,
anyway,
I got my money on it too.
When I give this 68-year-old woman a mirror to look at her teeth, and she looks and she's quiet. She didn't get excited and say how wonderful I was, you know. And so that was a little bit of a tip off there. And then she asked the question you never want to hear after you're done. Are these the right shade? So I explained to her that I gave her the perfect shade for her age, and you never want to, the 4-letter word is bad, but the 3-letter word is worse.
What's the 4-letter word?
Oh, I don't know.
Oh, okay. I was thinking weight. That's 5 letters. They'll
Anyhow,
never
there's
tell
a
you
lot
their
of
weight,
those around.
but age, yeah.
But age is one, and so she didn't buy what I had to tell her, and she wasn't happy. But it was a perfect result. It's one of the best cases I ever did. So anyhow, I give her an appointment in 3 months. I says, you'll get used to it, you'll like it, and everything, you know. And I get a call the next day. And the next day, she's on the phone, and she says, Dr. Ibsen, about the shade. And so I start giving her my routine. And she interrupts me real quick, and she says, Dr. Ibsen, I don't like the shade, and my friends don't like the shade. I said, well, you better come right in. So I had to take a perfect case off, go from A1, and put on the whitest bleach shade teeth I could put on her, because you were talking about unnaturally cosmetic, but that's what some women want. So we got it all finished, and I changed them all for her. It's the only case I've ever had to remove and replace, because I didn't give her what she asked for. So that's why I want to make sure we get that across this interview. You better give your patients what they're looking for. And so that's why I asked that question.
What shade did you give her?
Look like? I gave her the lightest bleach shade you could give her.
Which is what?
Oh, I don't know. What is
B1,
it? B1, lighter than B1. If I had Lisa here, she could tell you.
Yeah, I know. I have 3 patients that they just do cosmetic surgeries on women. They say that 9 out of 10 women after a breast augmentation say they're too small. 9 out of 10. No matter what size you put in, they're never big enough.
They're never big enough.
Yeah.
But then you got to read. There's a good book called Self-Image Psychology by Maxwell Maltz. You could pass it on to your interviewers. He was a plastic surgeon in the 30s and 40s and 50s and 60s or something.
Self-Image Psychology by who?
Maxwell Maltz, M-A-L-T-Z. He was a plastic surgeon that found that some patients, when he corrected their cosmetic defect, it solved their problem, but some it didn't. So they had to find out what the real problem was. But anyway, back to her. When she left, she had the white teeth, she had red lips, hot pants, and no varicose veins, and she liked to hang out at one of the local, we live on the coast up here, pretty close to it, so they have a place called Vantana's and a sports bar. And so she would sit there with her senior citizens that are late-term adolescents. Another good book you may want to pick up, where you got these guys on here, called Spring Chicken by Bill Gifford. And it's all about people that are studying longevity and how you can live forever. And then it's Spring Chicken, how you can live forever or die trying.
And I just want to point out that, now that I've lived half a century, all leaders are readers. Bob's only been on this interview for not even 15 minutes, and he's already mentioned 2 books he's read, Self-Image Psychology by Maxwell Maltz and Spring Chicken by Bill Gifford. And I'm telling you, and a lot of dentists always say to you, well, how do you have time to read? And then you look at them and they They have so many television programs that they watch, and it's like, well, maybe your television time is a little excessive.
That's where I read. I put my book on the television thing. I got the Bible, and I got the books. I've read the Bible, but the Bible's kind of slow going, and Bill Gifford is kind of fun. I read a chapter or two and a chapter or two because they really have some interesting characters working on longevity.
So you're a Catholic, right?
I am.
So what do you think of this new Pope?
Well, he's a nice guy.
He really is. I mean, I tell you,
how could you not like him?
I know. I just did not see that coming. I mean, he's just what a rock star. I mean, he's just a television rock star, good old boy.
Look how he lives.
Yeah.
He lives in a one-bedroom hotel room where he gets room service. He doesn't live in the big castles and all that, And when apparently, I'm no expert on him, but I guess he used to ride motorcycles. And you ride a motorcycle, don't you?
No, I ride a bicycle. I'm too fat. Yeah. I'm too fat to get a Harley Davidson. The last thing I need is gas propulsion.
I guess he's kind of an off-the-wall guy. So whatever. But let's get back to some of the things.
And Bob, I want to say about that Pope comment to you is I don't know any dentist that made 1% of the money you made over the years. I mean, when you sold Denmad and you sold Rembrandt, I mean, you made a mint, and you're still the most down-to-earth, humblest guy I know. When you had more money than Bill Gates, you still were approachable. I'll never forget when I went over to visit you one time. I had my 4 boys with me, and you let us spend the night at your house. I mean, you're just a down-to-earth, humble guy. And oh my God, and while we were talking, they were destroying your house, and I felt so bad. And you and Marcy didn't even care.
No, we didn't care. If it was your boys, we didn't care at all. But thank you so much for that. But actually, if you think about it, how did I make that money? I made that money because I was protecting people's pulps. I've never killed a pulp. I've never given a patient an aspirin for any cosmetic dentistry. Now, I've done a lot of gold crowns and bridges, and it's still there 30 and 40 years later, but I've never killed a pulp for cosmetic dentistry. So this is for those patients who have no sensitivity, no problems. You've established a good dentition, and they want to look better. They don't want their teeth cut down. This is an example of something. I'll show this one to you. If this shows up here, you got this. This is Amy. So she's a volunteer at the hospital. And my hygienist of, I don't know, 40 years or 30 years or whatever. Anyhow, she brought her in to fix one tooth, and I did. And she said, "Oh, that's wonderful." So then I said, "You've just won the lottery." So I did this for Amy right here, and it's on our website too, isn't it?
Beautiful.
Yeah. See that? Now, I posted this on Dental Town, and a couple of the townies are real hard-nosed guys, and they try to complain about it and everything. But she's getting along beautifully. And if you listen to a couple of townies that are talking about cosmetics that satisfy a technician or another dentist, they would think this isn't just quite right and that's quite right. But she has a beautiful smile. She's so happy, and she's got a boyfriend now.
I know, and the dentist, when dentists tell you they're patient focused, they don't even get it. I mean, what percent of the dentists do you think are patient centered practices?
Well, I'll tell you, our problem is the dental technicians. They've taught us how to do crowns. They've taught us how to do full coverage. They've taught us how to do everything on stone models, and they ignore the fact this is a patient. With this technique, you can take an orthodontic patient that's 16 years of age that's had a perfect orthodontic result, but the teeth aren't quite there. Do we have a couple of those I could show right here? And like here. Oh, well, she's not 16. We've got some of those in our book. Anyway, well, here's one. Okay, look at that open bite. See that?
Yes, I do.
And is Judy here yet? Huh? Is Judy here? Okay. Now I want you to take a look at how we close the bite. See that?
Yes.
Okay. And here's Judy. I just had breakfast with her this morning. She's a friend of my brother's. Where is she? Okay. Well, I'll let Judy sit in the chair, and then you can look at her, and I'll keep talking. Okay, you sit in the chair, Judy. And no, I keep everything on, and you just sit there and put
Hi,
your
Judy.
look at this right here.
Hi, how are you?
Good. How are you doing?
Now give me the big smile.
Oh, beautiful. You're already
And
beautiful to
turn
begin with,
around.
but even more beautiful now.
Yeah, put your teeth together and smile, and rotate your head.
Beautiful.
Huh? And so we give you your pictures.
But
Okay,
do
Judy.
you like him, Judy? Do you like them?
Absolutely.
She worked for us with Denat for a while, and I was reluctant to ever do anything with bonding, but I never gave her an anesthetic or anything. We did that with a wax up.
Well, that's an interesting point. I just want to clarify. A lot of people don't hear correctly, and they think that you're saying no prep veneers, and that's really not a good term. What you're saying is more geniusly intuitive, that you can prep a tooth as long as there's no anesthetic and they're not feeling any discomfort. You can lengthen, sharpen, you can do whatever, but if you're not damaging their tooth enough to where they need to be numbed up, then we're all good.
You know, you have just said it perfectly. I wish I could have said it that way, but you know, you got to use Twitter a lot of times to get people's attention. No prep gets people's attention, but we should say no removal of sensitive tooth structure. Here's an example of an orthodontic patient. Okay?
Gorgeous.
She just got finished. See? And because I don't have to remove any sensitive tooth structure, I put that on, and sure, they get a little thicker, but it's not that much. They make the people that are technicians don't want us to see this. They want to make it more complicated.
Only a dentist could look at a gorgeous woman and say her teeth are too thick. No normal human being could do that.
Well, let's put it this way. Even if they are too thick, and I can show you many that are, quote, too thick as teeth go, but I can tell you this, that you would never know when you're looking at their facial profile that the teeth are too thick, and they get used to them right away with proprioception.
Yeah, and then what's more, if you're bonding these veneers onto enamel, what's a better bond string? Bonding a veneer onto enamel, or remove the enamel and bonding it onto dentin? I mean, you're the guy who started dental materials. What would you rather bond to, enamel or dentin?
Well, you know, how could that answer? There's two surfaces that are.
But you got to answer it, because there's 7,000 people listening, and there might be kids who don't know.
There's two surfaces that are the best to bond to: enamel and porcelain. Did you know that?
I know that, and you are another cutting edge. You would silinate the porcelain, and you would bond to porcelain, and other people would they wouldn't even believe that you could do that. How many times have you done that?
Oh, routinely.
And how long did it last?
Give me Mark Adams' pictures. Routinely. I treat porcelain surfaces like I treat enamel surfaces and dentin surfaces, but I give the proper surface treatment for the surface.
And what is the proper surface treatment on porcelain to be able to bond to it?
On porcelain, we treat it just like they make a composite. You see, I had an advantage. I made these composites. The way I wrote my first book, this is good.
You have a copy of your first book?
I think I got one around. It's really old.
I know. I want it, Bob. I got the first 3 books written by G.V. Black, autographed and signed, and I've always wanted your book. I want your book autographed and signed.
Okay, we'll get you one, but they're old and
I know. I want it.
And it's not very thick, you know.
I almost bought Pierre Fouchard's book on eBay, and I cringe. It's a chunk of change, but I don't want to tell you, because then you're going to sell me your book.
I'm not going to sell. I'm going to give it to you.
I seriously want it. I really do want it. I think it's a historical, groundbreaking book. I think it was the first. I mean, in all history-wise, you wrote the first book in cosmetic dentistry.
All the books you read are by erudite authors, and they're thick. And I've got the thinnest book on the biggest development in dentistry, called Adhesive Restorative Dentistry by Ibsen and Neville. And the way I found out about adhesion is I used to fly my own plane. And I had a guy, one of my lab techs, come in and says, you know, there's a company in South El Monte that makes sealants. And so I got in my plane and flew down there and met a guy by the name of Henry Lee, Lee Pharmaceuticals, Lee Nails. And
What city was he in?
in South Almani.
And didn't he
and they're
graduate?
still-
What
they're-
dental school did he graduate from?
He's not a dentist. He's a PhD.
Oh, he
well,
was a
no, he's not a PhD. Well, okay, I'll give you a little history in him. He
What was
went
his
to
name
MIT.
again? What was his name?
Henry Lee.
Henry Lee from Lee Pharmaceuticals,
Right.
which was those press-on nails.
And press-on nails. But he got his degree in chemical engineering at MIT. But he got his PhD from a diploma mill over the drugstore on the second floor of LA City College, right across from them. And the dean of the school was an ex-convict from San Quentin. So he's a brilliant guy. He really is. But he missed it because he was not trying. All I ever wanted to do was help people. I figure there's enough people to help and there's enough money to be made. And I think that a good example of what you said. I mean, the way you described all the money more than me and Bill Gates, I think Bill called me the other day and asked me what to do. That's a joke. We dentists are the non-coms of the wealthy. Just remember that, if you know what that means.
The non-coms of the wealthy?
You know how they have non-commissioned officers after they've been in a long time and they're good guys and they're not officers. They get to hang out at the officers' clubs. So we get to hang out with the guys that are like Mark Zuckerberg. Did you know that Mark Zuckerberg's father's a dentist?
Yes, Ed Zuckerberg.
Have you interviewed him yet?
Yes, I have.
Oh, he's
and he
a
gave
great
us
guy.
some great Facebook tips.
Yeah. And I took a course from him, and I went up to him and I said, you know, aren't you a little disappointed your son never followed in your footsteps? And he says, well, we've always encouraged our children to think. But look at, you know, what is that kind of wealth? And you got all of that. So
yeah, but you
it's
know
a lot
what?
of fun out
Mark
there.
is Ed's a dentist. His wife's a psychiatrist, and they had 4 kids. I had 4 kids. That is the most down-to-earth, balanced, humble, great family. One of the greatest ones I met. So you just know Mark Zuckerberg's got to be a good guy.
And he can speak Chinese very well, too, because at home, his wife, you know, is Chinese.
Yeah, and you know, it's funny because Ed's a dentist, and he married a MD, and Mark Zuckerberg married someone like his mom, an MD.
Yeah.
I just think it's romantic and cute.
Yeah,
and
she's Chinese. But now I was talking about his mother. I was talking about his wife.
Right.
She's Chinese, and she's an MD.
Right.
And at home, they speak Chinese, Mandarin or whatever it is. And so when he went to China, he was a big hit because he could converse in the Chinese language.
Unbelievable.
He's just a nice guy.
Yeah.
Anyhow, this is an example of, because we were talking about porcelain surfaces. Let's take a look at this one. I think it's the left central that is a porcelain veneer covering a porcelain crown. Now, I put 10 veneers in there. Huh?
So, Bob, so let me just ask the question. My job is to ask so many questions. So there's a dentist in there saying, well, Bob,
the patient is a dentist.
Wow. So why wouldn't you just remove the crown? I mean, just for the question's sake, why wouldn't you just remove the crown?
That's a good question, because if it was my crown, I'd rather have a veneer put on it than cut it off. Now, a lot of laboratories will tell you make a new crown. But let's take a look at Amy again. I want you to look at Amy real close. And look at her upper left cuspid.
Right, PFM.
That's a cantilever bridge. That's a bridge that was put there 60 years ago. 60 years ago, and it's still there. Now, is that a failure or is that a success? See, that's a functional success. That was a very good dentist. And so why do I want to take that out? How do I know my next restoration is going to last as long as the one that's there? So if you have a clinically sound situation, why remove it? All right, here's another one. Let me show you something here. Let's take a look right up here. Now, this is a dentist that did this, is an excellent dentist. I'd sit in his chair any day to have my work done by him. It's perfect. He's absolutely perfect. He's a pilot. He restores things. He's everything. And
he says what impressed me the most was the simplicity of the overall procedure.
Yes, because I did it for one of his employees. So he came in to see me, and I took an impression, and there I put the porcelain veneers, over the porcelain crowns.
Bob,
What?
how many dentists have you treated over the years?
Oh, I don't know, probably hundreds.
Yeah, I mean, so if you're listening to this guy, I mean, come on. The biggest compliment you can get that you know your dentistry is when other dentists sit in your chair.
Okay, well, now here's something where I encourage. This is the part that you can help a lot with. I encourage his dentist to come watch the procedure. Now, I asked him, if he'd like to tell him to come. So, and I never heard from the dentist. But now the guy comes in to get his veneers, see, right here?
Mm-hmm.
So he comes in to get the veneers, and he brings his wife with him and a letter. Now, usually when they bring their mother or their wife with them, they want to talk about something. And so the guy tells all the things that might happen, all of which have been rumors that are false about non-prep and all that resistance. So we've got to get dentists to understand what they can do and can't do if it's balanced on this no prep idea. So I told him I had never had this experience. And anytime he wanted, now get this to remember the advantages. Anytime I do a case and they're not satisfied, I can take it off and put them back to where they were when I started. You can't do that after you alter a tooth and you put shoulders and margins on it. And you've seen some of the lawsuits that have taken place where dentists overcut the teeth. Where's that headline? Do we have that around, Christy? And so anyhow, this is him afterwards. And this dentist could have been doing the same thing. And yet he never wanted to find out. But he restores airplanes. Let me show you another case that just came in. This is a failure. That's why I want to show it to you. Look at the top one. See that on the cuspid and the lateral? It's fractured. See that? Can you see?
Yes.
Okay. Now, guess what I did? I took it off, no anesthetic. See, I put that on 28 years ago. Now look at the teeth 28 years later. They're just as good as the day I put the veneer on. See, the veneer strengthens them.
So, Bob, why do you think dentists just always have to get out their drill and drill off enamel?
Because that's how we were taught in school. And people, I will admit, I have a lot of advantage in having designed some adhesive materials. I had a dentist come up to me one time in New York after we came out with the porcelain repair kit. And he says, Bob, I can't chemically bond to porcelain. He challenged me. I says, well, you can't, but I can. So then he wanted to argue with me. He said, tell you what, we don't have to agree to be friends, do we? And we became friends. So that's the beginning. You got to be friends. But a lot of people have been teaching cut down too much to make them more of an expert. And they go out and get $3,000-$4,000 a tooth. And I get maybe $900, maybe $500. I just do this for fun. I kept my office as my yacht. And then I get to go down there and do these things for people. And it's a lot of fun. And the yacht never leaves port.
So Bob, and here's another thing I want to tell these young kids about successful dentists. It's funny. The only things I really like to watch on TV is, I know it's silly, but I'm addicted to the Arizona Cardinals NFL football. I know that's silly. And the other thing is I like Shark Tank. And when you're pitching a business idea on Shark Tank, and if you have an exit strategy, Mark Cuban says, if you already have an exit strategy, I pass. I mean, he won't even put $1 in his notice or anything about retiring. And watching successful dentists over the last 28 years and successful business people, they never retire. You're 83 years old and you're sitting in a dental office and you go on Dental Town and there's all these threads about how can I retire at 55 and how much I got to put away. And they already want to quit their job and they're looking forward to retirement. And you've got more money than everybody on that thread combined and you're 83 and still doing it. What advice would you give to those young kids who hate their job and are already looking forward to retirement and are trying to fund their 401k and their pensions and all that because they want to get out of it?
Yeah.
What father-son advice would you give them?
Well, when I got out of school at USC, we were considered to be one of these schools, gold foil operators and top drawer. And all I wanted to do was be a better dentist. But I enjoyed dentistry. And somehow they don't enjoy dentistry. Now, many of the techniques that they're following, I mean, who could enjoy dentistry more than I do when I don't have to give you a shot and I can make these transformations like this?
But
And
Bob,
they can't too.
do you think they don't enjoy dentistry because they're hardwired at birth with a bad attitude, or do you think they got a normal brain and it's just a bad attitude, or do you
I think
think,
they have.
or
I think they,
what do you think it is?
most of them I have found are really sincere guys. And
I love them.
and they
I
have a
absolutely
level
love them.
of excellence that's unrealistic.
Correct.
And they're being told what's excellent by a laboratory technician, and they're using prep teeth as an example. Remember how we used to watch
And
guys
they go to
show,
lectures,
yeah,
where
yeah,
they get off showing their only 5 best cases. They never
yeah,
show
yeah,
100 of their abortion cases, and
yeah.
their whole get off is to make you feel that you're inferior to them, and then you go home and try to be. It's a crazy game, and they
That's
just
right.
got to relax and be humble and realize we're all humans, and at the very end, we're all going to be,
Well, now think about if you're going to get sued, how's somebody going to sue you? There's only 2 ways you never get sued. If you don't have any assets, they never sue you. The other is don't do any irreversible damage. Anything where I work on a patient, I make sure that if I'm doing something that's irreversible, and I've done a lot of full mouth reconstruction cases, and by the way, occlusion is an important part of having that knowledge when you finish a case so that you don't have traumatic occlusion in there to cause it to fracture. But the bottom line is that everything I do is reversible. The world doesn't need another good dentist. There's so many good dentists out there. Why the world needs me is there's so many people misleading our colleagues about how much damage they have to do to a tooth in order to do something to it. And sometimes we have to when there's caries and fractures and things like that. But otherwise, there's no need to do what I do. And so my goal is to have somebody still talk to me. You know, the nice thing about not having everybody agree with me is they talk to me. And if everybody agreed with me, I'd just be another guy agreeing on J.V. Black's technique for a class 2 amalgam. We don't see lectures on that anymore. So that's why I do this, because every tooth that I save, I'm saving some patients somewhere from having a dentist do, a well-intentioned dentist, doing damage to their teeth and causing them pain and suffering. When I hear people say, I got veneers and it was an unpleasant experience, I'm saying that is a shame because it was so unnecessary. And that's why I still do this. Now, do you know what they do to you in purgatory?
in purgatory. All I know.
Okay,
What do they do?
I got to tell you a funny story. This goes back maybe 30 years ago when I was just talking about using composites, you know, for bonding. And so the audience, it got kind of quiet in the afternoon. And so then I'd ask them, I said, you know what they do to you in purgatory? And everybody wakes up, purgatory. And everybody knows about purgatory. So I said, all the pain and suffering you caused in life that you didn't need to, you get to experience before you get to heaven. So all those teeth you cut down that you didn't need to, now that you know, man, did I sell a lot of product afterwards. Now, I got a problem. So in 2007, Credit Suisse comes along, and the plan was to expand this opportunity for the whole world. So I thought, this is great. And it turned out to be that somehow or another, the guys, I sold them a cosmetic company. And they bought Denmat. They bought a dental materials company and a dental lab, and they're not the same. So anyhow, that's
what year did you sell Denmat?
2007.
2007. What year did you sell Rembrandt?
2004.
By the way, when I die, I'm not going to purgatory. I'm going to go get a double waffle with cheese. I figured there's 0 calories after you die. I'm going to skip purgatory at heaven.
So
and just
anyway, the problem that I have is that now I go to heaven. And they say, well, Ibsen, did you have a nice time? And I said, well, of course. I did this, I did that, you know. And I say to all these people, and they said, well, you know, they didn't carry on your thought of protecting the pulp. So all those people you could have been teaching while you were sitting on a boat drinking too much booze, you could have been teaching other dentists not to kill pulps. So all those dentists that you could have helped and prevented, you got to experience all the pulps they killed because you didn't do something. So that's why I still do this, because it's a lot of fun besides. And that's why I continue to do this. I'm still relevant. You know, here you are.
You'd be more relevant and you'd make my day. You've never even built me one online CE course on Dental Town. You should do this. You should do this online CE course because, Bob, we put up 350 courses and they've been viewed over 500,000 times in all 206 countries.
Well, I'm working on one right now for Howard. Is that the courses you're talking about?
Oh, you're working with Howard Goldstein?
Yeah.
Awesome. I did not know that. Yeah.
Okay.
And you're going to do it?
Well, we were working on it now to try to make sure that it's clear. One is on the patient for bonding porcelain to porcelain. And we got maybe how many videos? 50, 100, 200 videos. I got a studio in my office. And I jokingly refer to my office as my yacht, because I used to go have a glass of wine with some of my buddies, and we get a big boat, and they wanted to impress me, so we go out and we sit at the dock and drink a glass of wine, and that was fun. But now I go to my office, and I put veneers on people, and they say I'm wonderful. Nobody told me I was wonderful after I was drinking. Nobody told me I was wonderful after I played golf, you know, but they tell me after I give them a new smile, oh, doctor, you're so wonderful.
When I play golf, the golf course always asks me to please never come back. But so you sold Rembrandt in 2004. How is Rembrandt today? Do you feel good about it? It's 2015. Do you still think Rembrandt is a better toothpaste for people who have a lot of anterior composites or direct composite veneers? Originally, you had made that because you thought the Rembrandt toothpaste left a better luster on the direct composite veneers.
Well, it
is that
did.
still the deal?
Here's how that happened. See, there's always a problem and a solution. So, and I had enough knowledge of chemistry, and it came slowly, and how to solve problems using chemistry for solutions. So here's the way it worked. So I'm doing direct bonded composites on my patients, say like changing the rotation of a lateral just by putting the composite on it. And patients come back and they say, you know, doc, that looked pretty good when you put it in. But then after a while, it started getting dull and stained. So then I looked at all the toothpaste. All the whitening toothpaste out there before Rembrandt relied on abrasion. So I decided to take a different approach. I got the formula for the lowest abrasion toothpaste you could find. So that would do nothing with abrasion to remove the stain. And then I put some enzymes in there. Why? To remove the plaque and the pellicle on the teeth, because that's what's staining. So I put that in there. We put in sodium citrate, we put in papain, and aluminum oxide, which we use for final polishing. So we put in the lowest abrasion toothpaste that would continuously polish teeth, and we subjected it to a double-blind study at Boston University, and when it came out, we were better than Crest and Crest tartar control. So it cleaned better with lower abrasion. So that's how Rembrandt got started. And of course we had, you know, Procter & Gamble didn't call me up and say, oh, let's be buddies. Because we were saying we were better than Crest and Crest tartar control.
But you sold it to Procter & Gamble, didn't you?
No,
and then they got swallowed by Gillette.
Here's the way that went. Rembrandt, the toothpaste, was going just great. Retailers loved it. It was a premium toothpaste. It was all over the world. And what happened was that Crest came out with white strips. Well, we always wanted to come out with our bleaching agent and go over the counter with it. But I didn't want my buddies to get mad at me and start knocking my toothpaste, so I didn't do it. But when Crest came out with white strips, we thought, like, you know, racing, you draft behind the lead racer. So we thought we'd come out with our whitening, and it didn't bother anybody. And we had all the clinical studies. We gave better value. We gave more bleaching. We gave everything. It was better than Crest white strips. So we thought we're going to do it to them again, because we had 80% of the premium market and a premium price. So, and the retailers loved us because we represented more profit to the retailer, so they wanted to have it there. It was, as you know, it was just a dull category like soap. So anyway, what happened was that we took the Rembrandt and put the ads out, and told them how much better we were than white strips and everything. And now the total market for over-the-counter whitening at that time that we and Crest White Strips came out was $30 million.
$30 million. Is that just for U.S.?
U.S. Now.
In 2004.
Probably 2003.
Okay, 2003.
Anyhow, we thought, man, we're going to really whip them good, and we did. We got $30 million in sales our first year. You know what Crest White Strips got? $600 million. And I says, wow, what did they do? We had the better product. We had the A. And that was a C student going out there getting to be head of the company. You know what I mean? We've talked about that, right? Sometimes they had the better practices. So anyway, I'm looking, I say, what is it that Procter did? Because they were always so engineering type. Well, I saw an ad in a women's magazine that said, hey, left white, toy soldiers marching across the page, Crest White Strips, left white, Crest White Strips. And I said, how are you going to compete with that? Well, the way we got to Gillette was that I said, okay, Gillette would buy our toothpaste. Gillette couldn't make a toothpaste they could sell like ours did, so they would buy our toothpaste as a premium to sell their toothbrushes. So I called the guy up, I can't think of his name right now, and I says, tell you what, you sell it and we'll make it. And he says, oh, why don't we just buy you? I said, we don't want to sell. So we negotiated, and finally I asked him, I said, why are you offering us so little for Rembrandt? He says, we got to close your company. It's going to cost us a lot of money. I said, I give you a deal. You just buy Rembrandt and we'll keep the company. So that's how we did that. 3 months after Gillette bought Rembrandt, comes along Procter & Gamble, and they offer to buy Gillette. Well, we had an agreement where there was future payments out there based on it, so we had a little discussions there, which worked out okay. But the bottom line was that Procter & Gamble could not buy Gillette unless Rembrandt was divested. So Gillette divested Rembrandt and sold it to Johnson & Johnson. So now when you see, if you go to the website for Rembrandt, you'll see how Johnson & Johnson mentions that I was the developer and everything in it. It's still on the shelf. They don't spend any money advertising, but it's all over the world. It's a premium toothpaste. I still pay retail for it, although I guess I get it from Amazon now. But the bottom line is it's still the best toothpaste. It still works the best. And there's a couple other good ones out there that we are trying. And one of them is from Arm & Hammer, Peroxicare. That seems to give good results. And another one is Kirkland with their deep cleaning toothpaste. And I saw a few patients that had good results with that. But anyhow, I'm totally out of the materials business, and I'm just doing this primarily for helping the world know they don't have to have their teeth cut down. Now, what I wouldn't mind doing is hooking up with somebody who's got 1,000 offices that says, we can do porcelain veneers without shots and drilling. That's why we call it Smile Simplicity.
Have you talked to Rick Workman? He has 1,500 offices.
Well, no, I haven't. I don't know who to talk to. I should have been talking to you.
Well, you know, Rick Workman, you both got a jet. Why don't you just go meet at 30,000 feet over Phoenix, and I'll try to jump up off my ceiling and catch you guys.
Well, sure. I would like to do
Rick
that.
Workman would love to meet you. He's from Effingham, Illinois. You're of Santa Maria.
I never heard of Rick Workman, so you have to.
Have you heard of Heartland Dental Care?
Who?
Heartland Dental Care.
Oh, they have my respect because he goes out for quality.
And then there's another one in your backyard, another great guy, Steve Thorne, that owes Pacific Dental Services.
Oh, yeah.
So, Bob, how did you pick the name Rembrandt?
Oh, we were sitting there, and we had just developed this toothpaste, and we had this study. And so we had a really good marketing guy, and he says, what do we call it, the Denmat? Oh, it wasn't for toothpaste. It was for different color resins to modify their composite, because in those days, we only had one shade of composite. If you wanted gray, you used Kerr. If you wanted something that was A1, you wanted to use J&J's Adaptic. So by putting these resins together with tints in it, we call it the Denmat Shade Modification Kit. So he said, this guy, he says, you got to put something with pizzazz to it. I says, like what? So he starts rattling off names, and one of them was Rembrandt. Well, who was Rembrandt? The master of color and art and everything. So we call it the Rembrandt Shade Modification Kit. Then we had a crazy PR guy, John Lockhart. I don't know if you ever met him, but he went out and got us on the Today Show. So we were on the Today Show with Rembrandt, where, what was the guy's name that was on there? Brian Gumble was on there, and I'm trying to think of the dentist. He was a dentist down in Beverly Hills. So Brian Gumble says they're going to change your teeth. They're going to paint fillings on your teeth. But they got so many calls coming in as it went through the time zone. Everybody remembered Rembrandt, and the dentist called in, the patients called in, we want Rembrandt, we want Rembrandt. So when we came out with the toothpaste, we said, Rembrandt's been quiet for a while, and people don't really think of Rembrandt as a shade modification kit that much. So we said, let's call our toothpaste Rembrandt for the art of brushing. And
the art of brushing. Wow.
And tooth whitening. So that's why we call it Rembrandt. And the name Rembrandt got everybody's attention, because who ever heard of a toothpaste called Rembrandt? Now, I'll tell you another funny story. They had a quiz program, and they said, okay, what did Rembrandt do? Rembrandt made a toothpaste. He was a famous artist. So he's probably up in heaven waiting for me now.
And he was born in 1606 in the Netherlands. Netherlands means which means lowlands. They pronounce it Netherlands.
In Dutch. Yeah, he's Dutch.
1606, and what? Sir Isaac Newton was what? 1687 Principles of Mathematics.
I guess.
He was
You're more of a student than I am.
Hey, Bob, I want to totally switch gears. I only got you for 8 more minutes, and I can't think of anybody. I mean, you graduated from dental school, USC, in 58. I was born in 62. I can't think of any better person to ask that. Bob, the bottom line is this. The people who teach occlusion make it this big old mystery where you almost need a Ouija board, and they say, can't open the bite, this, blah, blah, blah. I want you to summarize what these young kids need to know about occlusion. Try to take the myth out of occlusion.
Okay, I'll give you the Twitter, and it's everything you need to know.
The Twitter of occlusion.
Okay?
That'd be
Here's
awesome.
The deal. You need to have closure in centric, true centric, and then you got acquired centric, okay? So Charlie Stewart is the guy I studied with down in Ventura. I went there for 8 years, 1 day a month, to learn all about occlusion. Now, when you're in centric, and Charlie called it the most retruded position of the mandible. By the way, you got to let me put some veneers on for you.
I don't need veneers because I don't show any of my teeth.
So anyway, we go down there, and I kept thinking every day, what was it I was taught? Closure, all the teeth meet in centric. Now, if you move out of centric and you go forward, your jaw drops. So you have what we call anterior disclusion. Then, if you go sideways, your cuspid is longer and you get disclusion. So the only time teeth touch is once in one position, and that's in centric. So that's a point of contact. And if you have cuspid guided disclusion, you have anterior disclusion, and it's harmonious, okay? You don't have any wear, you don't have any stress. Now, where is true centric? Charlie would teach us that it was the most retruded position of the mandible. So he would push on that jaw and go back as far as he could. And there was a lot of dentists in the course who still have, we should think of Dave, what's his name? He's another guy you should interview. But anyhow, I'll give you that in a second. So anyway, according to Charlie, it was the most retruded position of the mandible. At the same time, what's the group down in Florida? They're real good.
Institute.
Pankey. Pankey did not espouse that. He advocated group wear. So
Did you ever meet LD Pankey?
No, I never did, but he was a great guy, yeah.
But I'm sorry to interrupt. Go on.
But we didn't subscribe to uniform wear. And so other than that, everything was fine. So then I noticed on the dentists that had, after 3 or 4 or 5 years, had their teeth, we almost lost it there. We had their teeth 4 or 5 years later, had their teeth rebuilt with gold crowns. You'd see on the mesial facets of all the teeth wear, because people were shoving their jaw forward from that most retruded position. Today, I believe the correct position is what they achieve electronically. What's the group up in Seattle that's
Coyce?
Huh?
The Coyce Center? John Coyce?
Well, before him.
Seattle Study Club?
It's the electronic device that they anyhow, you it's a TENS machine. And
Okay.
That's where you locate it. And that is the place where the true, quote, centric is. So then when you build to that, and they have a device that measures that, the guy's on the tip of my tongue. I would be really good on, you were talking about what you like to watch. I got so hard up for a while I was watching Wheel of Fortune and Jeopardy.
Is that why you went back to work?
But I did watch the football game last night.
The Texas and the Colts.
Yeah.
But Bob, I want you. It's been the last 3 minutes. I want you to give some father-son advice. There's a lot of kids out there that are scared. They graduated $250,000 in debt. They think that when you were little, all the pharmacists were individual. Now they all got rolled up into Walgreens. There's a lot of kids out there, and they tell me they come by my dental office. There's 2 schools in now, and they say, I'm scared. I'm gonna graduate $250,000 in debt. Is dentistry dying? Is it all going to be Walgreens? Am I going to be working for CVC like a dental tech? What would you tell these kids that walk out of school with $250,000 in debt? Do you think they're all going to go to corporate chains and be working at Walgreens someday?
No, but some will. Some will find the corporate environment very good because they have all their office work, their HR and all that done for them. So that does offer a consolidation. Like, people who work at Pacific Dental are very happy there, and that's because all that's being done for them.
And those
I will say this in town. When I came to town, Santa Maria, it was 12,000 people, and if you wanted to be ethical and join the American Dental Association and the local society, you could only put your business card in, name, address, rank. You couldn't even put your serial number. Nothing else about you for 1 week. It was done. Now, I see so much advertising going on. I say, man, I'd hate to start now, because if I was, I'd want to do something where I could advertise the point of difference. But the one thing that they're not advertising is we can change your smile without giving you any shots. Huge opportunity, a point of distinction. You can't live on that alone unless you're in a big city where you've got a large pool. But the point is, it's a great point of difference when you're transforming patients' smiles and you're not hurting them. There is a great opportunity. Now let's talk about debt. So let's say the average guy owes $300,000, graduates from dental school. Now where does he go? Well, when did he have to borrow that much money? Fortunately, I was able to work part-time and borrow most of I had very little debt when I graduated, but I did have a little bit of debt. But what can you buy in the way of a house for $300,000 today? It's an average house, isn't it?
Right.
Okay. Now, what have you got when you got your dental degree? You have a license where the average dentist is one of the top occupations. So if you look at a lifetime of increased income that you have acquired and think of it that way, you've acquired millions in earnings over your lifetime. What is that to $300,000? See what I'm saying? It's all relative.
Absolutely. I mean, I agree with you 1,000%.
When you're living on Subway sandwiches and you're getting out of school, $300,000.
Yeah, but if you
really
don't like if you don't
Yeah.
like eating a Subway sandwich, you're no friend of mine. Last question. We're out of time. We're at an hour. These things have to end an hour. But Bob, there seems to be so much burnout, and so many dentists want to quit and they want to retire, and there's threads on Dental Town about America's best 401k, and there's all these people just trying to pack away money to get the hell out of it. Then there's guys like you at 83 still doing it, and you obviously don't have to. There's guys like me. I'm 53. I mean, if you told me I could never pull four wisdom teeth again, ever again the rest of my life, I would probably just right now start crying.
I know.
Why do we love
I
it?
don't know, because when I graduated, that was what one of my classmates said. Oh, I can hardly wait for the day I retire. Well, I retired the day I got my dental license and the day I got my dental degree. I was retired. I saw what I want. I saw patients I wanted to see. That was a great age in dentistry. It still is a great age in dentistry if you pick the right things. People are looking for Botox and that, and they're overlooking the opportunity to just help people look better.
But what advice would you give a dentist listening to you right now that's burned out and wants to quit and go home?
You know, why don't you and I put some thoughts together and how we can put together a thing on eliminating burnout, doing better dentistry, and helping more people and increasing your income while decreasing costs to the patient. See, if we put those things together, why would you ever want to stop doing that?
And I want to. We're in triple overtime. I want to end on this note. When I got this wild idea that I was going to start Dental Town,
I know.
everybody said I was crazy. AOL dial-up was stupid. And I was going to do a magazine. They go, Howard, these magazines are owned by companies that own 50, 80, 100 magazines, and they're in big fancy cities, and you're born in Kansas, you're born in a barn, you don't know anything about media. And I just so wanted to do this. And to make it free, it had to be advertising driven. And I told all the major companies about it. And who was the only person on earth that took all the premium advertising spots and supported me 100%? You, Bob Ibsen. I'm trying not to get verklempt. And if you wouldn't have done, you bought the inside front cover, you bought the back cover, and you were doing it just because you saw this young little kid who had a dream, and you basically bankrolled Dental Town.
Well, let me tell you what.
Nobody else saw the vision. And Bob, I will love you forever for that. Thank you so much.
I always said I wish I had your charm, because if I did some of the jokes and I did some of the stories you do on the stage, people would get rid of me. But you have a certain feel for dentists. You like dentists. You like what you're doing. And I just think what you've done has really been great, because whoever thought a toothpaste named Rembrandt would become one of the world's premium toothpaste?
And so I can assure you there would be no Dental Town if you wouldn't have bankrolled me the first year buying no matter what ad I told you to buy. I told you, does any of these ads, you bought them all. I mean, basically, you're the only guy.
If you told me that, I would have bought the magazine.
Oh my God. And now my whole goal, my whole dream was that, we were in the dental office all by ourselves, and I wanted to talk to guys like you and other guys. I just knew if we hijacked that internet so that no one would have to be alone, it'd be so much more happy and healthy and fun and informative.
Well,
we'd all do better dentistry.
That's what we've got to teach the younger guys. If you don't do some of these crazy invasive techniques, a lot of guys are placing implants, and I've got an implant and I believe in them, but they're doing it almost indiscriminately. And then in 20 months and maybe 2-3 years, a lot of them are failing. Part of it is the implant, part of it is the knowledge of the dentist. So this is where they get in trouble, is when some attorney gets it, or when they overcut teeth. I mean, that's why I'm doing this right now, to save people from having their teeth cut down from dentists that mean well, because the lab told them to cut away all that tooth structure. And so I think that what you're doing for the profession is incredible, and that shows because your business is still there. And I respect you for that. And when you called and said you wanted to interview me, I was amazed. I thought, I'm just an old dentist out here in the country having fun.
Oh my God, you're my idol. You're my rock star. My boys still talk about the night they spent the night at your house. Bob, I love you to death. Tell your wife, Marcy, how many years you been married now?
62.
Oh my God. Tell her, hello. Thanks again.
She's still in counseling.
She's still in counseling. All right, Bob. Thanks for all that you have done for dentistry. You're an amazing man.
Okay. Thank you.